Hello everybody, welcome to this episode of weight gain, weight loss, diabetes, and this new chapter which came, and that is remission of diabetes. I do have two wonderful doctors with me, one from England, that is Dr. Anthony Leeds, and I do have Dr. Michael Leeds with me. Our first segment was a wonderful segment. Everybody must follow, and you must share it with your friends as well. So in this segment, again, we are going to talk about the remission. I requested my wonderful guest today, which is Dr. Anthony Leeds. He is, of course, is a doctor. He is working on the diet. He's a researcher, and he is working internationally. The other person is Dr. Michael Leeds, and of course, Dr. Michael Leeds, he's a professor of human nutrition and consultant specialist looking after diabetes patients in Glasgow, and he will talk about the remission. Dr. Anthony Leeds and Dr. Michael Leeds, I welcome you to the show.
Thank you. Thank you.
Thank you. Now, in our last program, we did talk about remission and we did talk about diet. I have couple of questions and concerns. One question is, for an ordinary person like me, if you can give us some clues, what can I do specifically to see what is a balanced diet? What should I eat? Because Dr. Michael Leeds, you are a world authority on the obesity and diabetes research and treatment. Of course, for the human nutrition as well. Now, I have this question to you, and of course, we are talking about to lose weight for the remission of diabetes, but I have seen and I have come across many people, they are thin, they are not heavyweight, but they do have diabetes, they do have cholesterol level in them, and they do have heart conditions.
Mike, do you want to answer that question?
Yes. Well, you have two interesting questions there. One was you're looking for clues as to what people should eat if they're going to want to lose this amount of weight to correct their diabetes and the other conditions. And I give you two answers there. One is that we have used, for our clinical trials, we've used formula diets. Now, Tony Leeds is really the world authority on formula diets, so I'll let him tell you about that. But there is an alternative. Not everybody is able to do it, but you can do it using foods. And usually we find that it is traditional foods, traditional diets, cheap diets, which work best if people can wind the clock back and eat like their grandparents did, using very simple. We have a very simple diet in Scotland, which is very effective for Scottish people if they want to lose 10, 15 kilograms, get rid of diabetes. And that basically means you have porridge and a piece of fruit for breakfast, lentil soup and a piece of fruit for lunch, and more lentil soup and a piece of fruit for your dinner. Now that may sound boring to you, but actually it's how our grandparents did live, and you don't have to have exactly the same lentil soup each time. If you're having those three pieces of fruit and porridge in the morning, lentil soup, that gives you a pretty balanced diet, and you can keep that up for several weeks and lose the weight that way. The same would apply, and we're working with another group in Nepal using dal bhat. Of course, not quite as much large helpings as people might in their greed take, but not eating the imported foods, not eating the non-traditional foods. So that is one approach which is definitely worth exploring. And it's true to say that traditional diets, traditional lifestyles all over the world were associated with not having diabetes and not being overweight. It's only when modern westernized foods and diets came in that became a problem. Now, you're also correct that there are many people who don't look much overweight, but have all these complications of diabetes, heart disease. They are people with what we call metabolic syndrome, and that is probably a genetic or epigenetic condition which programs the cells of our body and the way in which our organs work to put excess fat into the internal organs. So whereas I might put on some weight, I haven't, but if I would put on weight, I would probably put it under my skin in the subcutaneous places, the places where you can actually feel it. And that does very little harm. It may be a nuisance and slow me down, but it wouldn't be damaging. If, on the other hand, I put it into the internal organs, then that does damage, and it does progressive damage, which can become permanent. And so it's likely that the people you're referring to who are not very overweight, a little overweight, are those people with metabolic syndrome who have put their excess weight into the liver, into the pancreas, into the heart. And we can see that using magnetic resonance imaging. And that's what we've done in the direct study, where we showed for sure that these people do have excess fat in the internal organs. And it applies the same. So if they have developed diabetes and heart disease and such like, high cholesterol, if they lose the weight, they will get rid of it.
Very comprehensive. So this means people should avoid processed foods, and they should go on to natural resources.
Much more than yes. I think that's a very helpful analysis. And there are many tricks. The people want a sort of trick to be able to stay on a diet which they find acceptable and indeed pleasant. So I'm lucky because I like porridge in the morning and I love my lentil soup. So if I ever develop diabetes, I would be quite content to use a very traditional Scottish diet. I'm also lucky because I enjoy dal bhat and I don't require huge helpings. So I would be quite happy to follow a Nepalese diet to get rid of my diabetes if I were Nepalese and developed diabetes.
Dr. Anthony, I will definitely, because you and Dr. Lean can discuss on scientific manner, but I have another question. Nowadays, to lose weight, and I have seen people getting results out of it, there is a diet. I have always heard that we should have a balanced diet, fruits, vegetables, and proteins, everything in it. But some people, they count on Atkins diet. There is some other where doctors, for example, here in Canada, there is a program which we join and doctors give injection and they control the food. There is another program where people only depend on the vegetables. They don't eat proteins in anything. There is another kind of diet where people only count on the fish. And so what do you recommend? So these Atkins diets and on one specific kind of food?
When we have discussed this before, what I've said is that any diet should be one for which there is a good evidence base and also a good safety record. And many of those popular diets have not been subjected to the type of very hard investigation that Mike Lean has been doing on the direct trial. So I think he'd probably agree with me that really most of us would only recommend diets which are nutritionally sound. They're providing a balanced source of nutrients that provide the appropriate amount of energy for the individual, because we know that restricting the energy is a critical thing for weight loss, but also one that has been subjected to investigation in the proper way. And what you will see is that any type of diet or other intervention which is produced good evidence will eventually get into the general guidelines and will be in general usage. And it's very important to recognize that the type of intervention that Mike has spoken about, which is the use of total heart replacements, is already being used in a number of health boards in Scotland and also by NHS England. And of course, he and I are both hoping that eventually we will be able to undertake the studies in other countries which will enable this type of intervention to be available there as well. So could I just transfer this to Mike for a moment and just ask you the question? Last time we described the direct trial, what are your wishes in terms of other investigations in other parts of the world? You mentioned Nepal, so that we can demonstrate that this type of intervention can be used, say, in South Asia and then also in Southeast Asia, South America eventually as well, of course.
Yes, I mean, you're absolutely right, Tony. I think the important thing is to start with the evidence base that we have and then build from that. So we know for certain that European people taking a formula diet, which is nutritionally complete, is enabling them to lose those 15 kilograms or more, some of them 20 kilograms, inside about 3 months and get rid of their diabetes. We also know now for certain that that is effective in people from North African and Middle Eastern origin from the Qatar studies. We'd like to see this repeated in South Asia or Pakistan in particular as an excellent example. And we are very confident that will be the case. Now, I'm also very interested in taking this into other groups where the principle of our study can be applied that weight loss can get rid of type 2 diabetes into populations where they can't actually afford any kind of medical treatment or formula diets, where we have to use foods. Now, then you're quite right. There are many, many diets being promoted for weight loss, and have been for years for weight loss, and more recently for type 2 diabetes. And we then have to be very careful because, as Tony Leeds has said, the evidence base is critical. There are some diets which are clearly better than others. So the one perhaps which is most popularly being promoted at the moment is a low carbohydrate diet. And this is a diet which then tends to have more of the calories coming from fat, with greater effect on cholesterol and things of this kind. So a little bit doubtful. And the interesting thing is that if people follow a low carbohydrate diet, they can lose enough weight to get clear of their diabetes. There's no doubt about that. But in the long term, if people then remain on a low carbohydrate diet, they actually are more likely to get the diabetes back from the observations that we have, the evidence that currently exists. So the long-term outcome is not so good. In that case, we should be looking at a more along the lines of a balanced diet that you mentioned originally, where there's a little bit of everything, but the quantities are reduced. You are also right. People have chosen vegan diets as an alternative, which is high in carbohydrate, or can be high in carbohydrate, but low in many, many things, and relies entirely on fruit and vegetables. And that is another way in which people are able to lose weight. In the long term, people on vegan diets and vegetarian diets in general have less heart disease and less diabetes. So that approach, which is more aligned to the Mediterranean style of eating that we're recognizing, seems to be perhaps the best long-term style of diet. And that, of course, is a reflection of a traditional diet. It has quite a lot more fish in than average, and rather less meat, and meat, particularly meat products, than is common in, say, North America. And I think, we would then also echo your earlier comments that removing processed foods from the diet is part and parcel of all these effective approaches. I don't know of anybody who's promoting a diet of processed food which would be useful for controlling health, particularly diabetes. Having said that, the formula diet that we use in the very short term, only for 3 months, is very effective for getting the weight loss. And so we have to then sort of separate out the effects of weight loss and those of the diet composition. And they go hand in hand in the long term, but in the short term, it's the weight loss which matters. And it probably doesn't matter which diet you use to get the weight loss. What then you do afterwards, we need to have better evidence.
Yes. So what you're doing is you're referring now to the issue of weight maintenance. And one of the things that people listening would be interested to know is, what specific things did you include in the program of education and guidance on behavior in order to get your participants to be so successful in maintaining weight and sticking with the program? Because that's one of the problems that people imagine they will have, and this is very important. And I know a lot of work has been done on this in Glasgow. Can you tell us what you have found?
Well, that's a very good point. So at the very beginning of the program, we asked people, where do you see problems for you? And we're going to offer you this program. We're going to try and get rid of your diabetes. And they all said that with support, they would be able to lose the weight. And they did. They also said they knew from experience, their own personal experience, that maintaining that weight loss in the long term was liable. We put into place two things. One was, we said, to maintain the weight loss long term, we're going to make available to you one formula meal in the day to replace what you would otherwise eat. This is a formula meal which would have only about 250 calories in it. So it's very much less than any normal meal that we would choose to eat as part of our daily lives. But that would be one way in which we could ask you to take one meal every day, which would be less than you would normally have, using the nutritionally balanced formula diet as a meal replacement. And that was very acceptable. About half of our patients did that and found it helpful. The other thing we did was to say to them, anticipating the future, we know that people with weight problems will continue to have a weight problem. Losing the weight, you do that. We know that things happen in your life. There'll be a crisis. Something will go wrong. And the temptation for some people, not everybody, but some people, is then to overeat because there's a crisis. It doesn't make sense, but people do that. And then they put their weight up, and then they get into trouble. So we offered them what we call rescue plans, which were we asked our patients to tell us if their weight went up by 2 kilograms, and if so, we would then step in, offer them the full formula diet program for a month, get them back on task to get the weight back down again, and refocus on the need for long-term maintenance. I suppose a further thing that we did in this trial was, as people were losing weight on the formula diet, they didn't have to make any decisions about foods at all. They didn't go to a shop for food. They didn't, eat out with their friends. They didn't even have a cup of coffee with their friends. They were on this diet to lose the weight, very much like taking chemotherapy for a cancer. This is serious medical treatment with a diet. During that time, we then gave them coaching in how they would then approach a shop to buy their food, the kitchen to prepare their food, how they would eat with their family and such like after they got the weight down for the long-term maintenance. And so we were very serious in our approach to maintenance in the long term. And that's part of the program that we developed. And as I say, the use of the formula diet as a meal replacement, once people got used to it and knew that it was effective, that was very helpful. We also tried an alternative technique, which was to say, instead of doing this for one meal every day, how about doing it for 2 days every week? So there'll be 2 days every week when you go on to a low-calorie 2 days. And the other 5 days you eat sensibly. And for those 2 days, they could either use the formula diets for those 2 days, just as they had done to lose the weight, or they could use a very low-calorie alternative, 800 calories alternative made up from foods. And some chose one, some chose the other. So I think as long as you focus on the need, people's needs, and they clearly feel the greatest need is to maintain the weight loss, not the losing. The losing was relatively easy.
I know, and you know, because we've spoken to many people having lost weight, that they are then very highly motivated to not regain weight. And certainly the people I've seen in Copenhagen who've lost weight, who've had very bad knee osteoarthritis, didn't realize how bad they were until they lost weight and the pain went away and they could then sleep at night. And so sometimes people don't realize just how bad they've become. Maybe it's the same with obstructive sleep apnea as well, which of course quite commonly occurs with diabetes, where until you've actually lost 15 kilograms in weight, you don't realize how badly affected you are by your obstructive sleep apnea and how much better it can get when you lose weight. So I think that's a factor. I don't know whether you've seen that, I'm sure.
Many times. And we kind of tend to forget, because we focus on diabetes and heart disease, we forget that with people who've got a serious weight problem, or even quite a modest weight problem, their main day-to-day obstacles are things like aches and pains, breathlessness, tiredness, having to stop on the stairs, things like this, which just grind you down. Now, these things get better, and people notice when they've lost 15 kilograms in weight, they notice that they're more able. They can get up the stairs without stopping. They don't feel breathless. They sleep better at night. Sleeping better at night is a huge improvement with weight loss, and it's something which I think doctors neglected.
Yes. One of the things we should also do before we end is to comment on prevention of diabetes, because there will be people listening who do not yet have diabetes, but they're in a family where there is a history of diabetes. They may wonder what to do, and we will provide some web links at the end of the program which take you through to websites where you can put in the information and check to see what the risk is, and then if necessary go and see the doctor. But can you make a comment, Mike, on the risk factors that will be an indication of people are at risk of diabetes, and then what they should do?
Yes, and this is actually good news again, because we know very well that people developing type 2 diabetes can step in, lose a bit of weight, not necessarily 10 or 15 kilograms, but perhaps half of that, say 7 or 8 kilograms, and put that progress into check so they then do not develop the diabetes. So it's very important to identify people who are on the slippery slope, who are running into problems with diabetes in the next months or years. And luckily, we are able to identify them really quite easily. The family history is critically important. So if you have a parent, a brother or sister, or even uncles and aunts with type 2 diabetes, then you're at greater risk. You're more likely to develop the diabetes. If you have more than one, then that risk goes up many times. So particularly if you have a member of each side of your family, your mother's side and your father's side with diabetes, then the risk is really much higher. And then we can identify from that individual the level of risk is closely related to the amount of weight which they put on, but not specifically, not general weight, it's the weight around the abdomen. So the waist circumference, and this goes back to some much earlier research that we did here in Glasgow, waist circumference is a very important predictor of risk. So Asian people can identify this with a cutoff of waist circumference, which is lower than that for Europeans. In Europeans, we say that your risk of diabetes is clearly increasing as the waist goes above 94 centimeters. That's 36 inches. For an Asian person, we would reduce that to 90 centimeters, which is about 32 inches. So an Asian person, Pakistani person, should not allow their waist for men to go above 32 inches. For women, the figure is quite a bit lower. It goes down to about 84, which I'm going to get stuck on my inches here, but it's about 84 centimeters. You can work that out for yourself. It does mean that with a family history and a waist circumference, you can identify a large number of people who are at risk of developing diabetes. So if you have a family history of diabetes and you have a waist above those cutoffs, 90 centimeters for men, 84 centimeters for women, you should go and get a check. And if I were you, I would lose some weight and get yourself below those cutoffs of waist. Don't wait to get diabetes. Do not wait for diabetes. It's a really disastrous disease. It wrecks families, it wrecks communities, and it certainly wrecks individual lives.
Yes, and all of the diabetes prevention trials have shown very clearly that it's the weight loss that is probably the most important thing that you've got to do, but also increasing physical activity and changing the nature of the diet that is consumed. Do you want to comment on the sort of optimal composition of diets for maintenance once people have lost a bit of weight if they're at risk of diabetes?
Yes, well, I think the most important thing is the diet which is able to maintain that weight loss. And we have to be a little bit relaxed on this because diet compositions can potentially aggravate the risk of diabetes. But if somebody follows, that risk is less than the effect of being overweight. So the big factor is being overweight, and getting the weight down is the most important. So it doesn't much matter which diet you use. If you have a choice, and if you're able to pick a diet which will maintain that weight loss and improve your health in other ways, then you would pick a diet which is not very low in carbohydrate, but is also not very high in saturated fats, which will put up cholesterol. And I think at that point, you then say, well, that is when physical activity becomes really valuable. Physical activity is not particularly helpful for weight loss. It can, for some young men, be helpful for weight loss, but for people who have diabetes or at high risk of diabetes, physical activity is often very difficult. They find it difficult to maintain physical activity, to keep regular daily activity up. It has to be every day. And that's partly because people with type 2 diabetes have different muscle types from other people. So people with type 2 diabetes have type 2 muscle fibers. That's the easy way to remember it. And those are the muscle fibers which do not burn fat, and they don't allow you to have endurance capacity. To get rid of or to avoid diabetes, you need physical activity, but it has to be the type of activity which gives you endurance capacity. Weightlifting is not going to help very much. It might help a little bit. It'll keep you out of the kitchen. But if you really want to avoid diabetes, you get your weight down, and you then use your legs for endurance type. Even walking, keeping walking is helpful.
Thank you very much, Doctor. We are out of time. Dr. Leeds will give the links, but this is what I say. This is what I understood. There are changeable factors, non-changeable. Non-changeable mean your age and family history. Changeable factors, of course, we must watch what we are eating, exercise, do not use processed foods, and just eat balanced diet. Education and guidance, these are the most important things. Yes, Dr. Leeds, we will summarize over here. I thank Dr. Michael Lean. Please tell us about the links.
Well, there should be 2 pages of links at the end. The first ones will take you through to pages on the UK Diabetes Charities website, which describe the direct trial for you. And then the second page gives the links to the Canadian, Indian and the UK websites where you can find out the risk of diabetes. So there's the diabetes risk calculators. So please go and look at those if you think it's appropriate to do so. And finally, as I've always said, it's important to gain individual guidance from a physician, from a dietitian, and as far as exercise is concerned, if you can do so, a physical exercise trainer or a physiotherapist. Always get individualized guidance, if possible.
Thank you very much. Thank you very much. Dr. Michaeline, I thank you also. You gave us wonderful information. Dr. Anthony Leeds, thank you very much, and we'll see you next time. God bless everybody.
Thank you. Thank you.
Goodbye.
Thank you.
Goodbye. Thank you.
Goodbye.
Thank you.
Stay safe and stay blessed. Take care. Bye-bye.